Good day, I'm Andrea Chizom and this is your JIS News for Wednesday, November 5. Jamaica's unemployment rate declined by 1.6% in July 2014. In its July labor force survey, the Statistical Institute of Jamaica Statins said the unemployment rate stood at 13.8%, down from 15.4% in July 2013. The number of unemployed persons decreased by about 11%, moving to just over 179,000. A breakdown of the numbers reveals 1.8% fewer males and 1.5% fewer females in the unemployment line. The unemployment rate among youth aged 14 to 24 years also decreased by 4.2%, moving to 34.1% in July 2014. The hotel and restaurant services and education sectors accounted for the largest increase in the number of employed persons. Statins labor force survey for the month of July was conducted from June 22 to 28. Caricom heads have adopted a 10-point plan of action to stop Ebola in West Africa and prevent any spread to the Caribbean. The resolution came out of a special heads of government meeting in Trinidad and Tobago Tuesday to discuss both Ebola and chikungunya threats. Stacey Smith has more in this report.
Caricom's Ebola Action Plan calls for the creation of a regional rapid response team called CaribReact and the establishment of a regional coordinating mechanism on Ebola to be chaired by the Caribbean Public Health Agency, CARPHA. The Harmonized Regional Operational Response Plan is to be finalized and implemented by the end of November. Meanwhile, a comprehensive resource mobilization effort is to be organized, including a possible Stop Ebola There and Here SETH fund, to which government, citizens and businesses here and abroad may donate. CARICOM leaders also called for stronger measures at ports of entry, including harmonizing travel restrictions in the region. They identified the need to strengthen national health systems and participate in capacity-building efforts at the global and regional levels to gain experience. An intensive public education campaign is also to be launched region-wide. Barbados Acting Health Minister Donville Innes, who gave the keynote address at the meeting, said this was crucial to preventing panic among the populace.
Policymakers and technical officers who deal directly with the public must be prepared to establish and gain the trust of the public by presenting information in an objective and understandable manner that enables them to take the necessary actions to be safe.
Representatives of PAHO, WHO, the United Nations, development partners and other contributors are to be invited to a meeting within 1 month to expand the effectiveness of the region's collective response. The effectiveness of all these measures is to be reviewed at the CARICOM intersessional meeting in February 2015 and again at the Conference of Heads in July. Stacey Ann Smith reporting for JIS News.
Meanwhile, back home, the Ministry of Health has assured residents in close proximity to the National Chest Hospital that systems are in place to protect their health in the event of any Ebola cases being treated there. The hospital is one of only 2 sites where Ebola treatment centers are to be established. The other is the Cornwall Regional Hospital. In response to public concerns, Health Ministry officials met with residents of Barbican Terrace, Barbican, Hope Pastures, Standpipe, Mona, Cedar Valley and Ravinia Tuesday night. Acting Permanent Secretary Dr. Kevin Harvey stressed that the ministry was adhering to international standards. He pointed out that the National Chest Hospital was developed as the specialist facility for infectious diseases such as tuberculosis, and there has never been any negative effect on persons in surrounding communities. Residents were urged to assist the country's preparedness and response measures by paying more attention to hygiene practices, including regular hand washing. On to another public health issue now. Communities are being urged to get involved in government's ongoing cleanup campaign to eliminate mosquito breeding sites in response to the outbreak of the chikungunya virus.
It has to be a community effort to help in cleaning up our environment. I think Jamaica can do it, and I think Jamaica will do it.
The coordinator of the National Cleanup Campaign was speaking recently on a special televised panel discussion on the government's response to the outbreak of the chikungunya virus. The program is an initiative of the Ministry of Information and the Office of the Prime Minister. The initiative is in line with agreements reached by regional health and foreign affairs ministers who participated in Tuesday's special CARICOM Heads of Government meeting. The meeting called for a multi-sectoral approach to fighting the disease, strengthening vector control response, continuous public education, and PAHO WHO support to purchase key supplies. And finally, the National Land Agency NLA is implementing technology to reduce land registration turnaround times and improve its customer service. It's being done through the use of software called the Estate Management System. Manager of Property Services in the Estate Management Division, Peter Baker, says the software has allowed the NLA to replace the existing land registration and parcel management system with one that is now fully automated. At the same time, the agency has introduced public online access to information.
So at a, well, I wouldn't say press of a button, but at quick access, we can easily know what property we have leased, what property is available, etc. So we're in that process of updating our inventory.
Mr. Baker was speaking at a recent JIS think tank. He said the system would also allow the land agency to improve revenue collection, manage rent reviews, enable real-time collection across the island, and reduce the time for property divestment from months to a few weeks. And that's it for JIS News today. I'm Andrea Chisholm. Thank you for watching.